How will manual therapy help your patients? Hi, I'm Dr. Michael Lee, founder here at The One Method. Thank you so much for checking in today. If you are a physio, chiropractor, osteopath, doctor, sports therapist, thank you so much for checking in, because you're probably reading the headline thinking, I do that every day anyway. And you probably think, what am I going to gain from this session? Because, of course, in the One Method, we don't just look at one area, we look at the whole system as a whole. But a lot of people, they think, oh, Michael, but aren't you like very anti like manual therapy? Actually, it's not that I'm anti manual therapy. It's a case of it has to be used at the right time, because you can't say, just ask you the question here. If you are a clinician, I'm going to ask you, when you have one tool, do you use it for everything? Because if you use it for everything, you'll find that it only works better. It'll work better for some conditions or certain problems, but it actually doesn't make much of a difference for other things. So this is why it's important to, I say, for when I'm teaching clinicians, is to build up your toolbox. Because what you'll find is, as you're building up your toolbox, you think, actually, I've learned this new. It's not that you're just going to add it. You usually actually exchange it for something else that you've been doing. Oh, now this new tool actually works better and faster than this thing that I already know at the moment. So when it comes to manual therapy, and the great thing is that what we generally find for a lot of patients is that they live in something called hopology. They're kind of thinking, oh, I can manage it myself, I can stretch, I can do this and the other. But ultimately, if you think about it this way, there's never been a champion, Olympic gold medalist, or even an athlete that's actually won anything without having a team behind them. A team of manual therapists, a team of chiropractors, a team of physios, a team of doctors, a team of acupuncture, whatever it may be. But they've had the team behind them to offer their skills and services to make sure this athlete can actually operate at their best. And manual therapy has its place. And generally, when we look at, for example, sports massage, we're looking at how to improve recovery. How to improve recovery. What we mean by recovery, say, for example, an athlete has been exercising really hard. They've been like in the gym, they've been squatting, they've been sprinting, they've been jumping, doing whatever sport they've been doing, right? They've worked hard. It's always going to cause micro tears in the muscles. And with those micro tears, there's going to be bleeding, there's going to be edema, there's going to be debris, and also ultimately there has to be nutrition that gets to the area to help repair. And this is where, yes, treating the lymph system, treating the circulation, treating the tissue that has been damaged manually, yes, will help get the nutrition to the area. Because remember, there are two pumps in the body. Primary pump, heart. Secondary pump, muscles. If muscles have been damaged, guess what? Secondary pump isn't working so well. So yes, massaging is going to help encourage getting rid of the debris, the edema, but also bring nutrition to it. Because if that muscle is damaged and it's got DOMS and it hurts, it isn't going to be contracting, relaxing to actually allow fluid to move or allow the nutrition to get to the area. That's why manually really helps. So I would just say, yes, massage is great for recovery. But what I would say is massage isn't so good for treating pain. Because, yeah, they say, oh, yeah, you can trigger point it, you can acupuncture it, yeah, great. But the thing is, are you even stretch an area? How soon, or even manipulate an area, how soon does it get stiff again? Very soon, right? Within an hour, 2 hours, 3 hours, but whatever it is, it gets stiff again. And the question is, why? I've just had the treatment, I've just had the massage, I've just had the manipulation, I've just had the acupuncture. Why has it got stiff again? Because releasing something, how is that going to fix something? Because you got to think, the question is, when something's tight, or we call it hypertonic in neurology, it's hypertonic for a reason. It's hypertonic because it's doing the job of something else that isn't working. So if you release something, the thing that's not working, is that still not working? Of course it's not working, you haven't done anything to it. So if you release something and then the other thing, the other muscle that's not working, it still isn't working, it actually creates gross instability. That's why everything's really floppy, right? Really relaxed after the session, because nothing's really stabilizing as well as it can do. But essentially, the brain still needs to switch on what can work to stabilize the area, which is essentially the thing that got released. And then they're back to square one. How many of you understand that? All right? It's about finding the cause. If we don't find the cause is just, how do we get the muscle that's not working again, then the one that's actually bracing or working really hard or really tight doesn't need to work so hard. This is why a lot of clinicians get it wrong. They're thinking, I need to just do manual therapy. And guess what? They hit a brick wall because they've been doing it for so long, it doesn't change the symptoms. Or the problem just keeps coming back over and over again. Because they haven't found the root cause. But this is where manual therapy can help, is yes, recovery, bringing nutrition to the area, getting rid of debris, getting rid of fluid, getting rid of any damaged tissue in that area. That's where it can really help you. Scar tissue, it really helps as well. And this is one thing that, yes, we can add to manual therapy is active release technique. Because active release, yes, we are actually fixing an area. When I say fixing, as in stabilizing an area, and then getting the tissue to move underneath it, and then it's going to break down the scar tissue. That's brilliant if there is scar tissue there. But there's an assumption from a lot of clinicians, oh yeah, I have to do it because there's going to be scar tissue, there's going to be scar tissue. Yes, I get it. There will be some micro tears from training and that. But true scar tissue is either an incision from a surgeon or a tear, a big major tear in the muscle, at least a grade 2. Grade 1s, it would be so minor anyway. As soon as you get moving, the collagen fibers will go back to normal fiber, normal tissues, again just through normal movement. But ultimately, if you're unsure if there's scar tissue there, quite simple, do an ultrasound scan, and you'll know. And generally, whenever I love challenging clinicians, I say, oh, you're breaking down scar tissue, yeah? All right, let me scan it first. Scan it. There is no scar tissue. So what are you breaking down? Scan it. There is no bleeding. There is no fluid. What are you breaking down? There is no scar tissue. It's just a hypertonic muscle. It's just a muscle that's bracing. So this is why it's so important to find out what it is, have the clarity of what the problem is, and as soon as you have the clarity of what the problem is, you have better clarity in terms of what you need to do next. And what you do, and as soon as you know what to do next, that's where you're truly going to help the patient. Because there's nothing worse than just applying a treatment on assumptions, because you're just guessing. On assuming that, oh, there could be scar tissue, I'm going to break down scar tissue, but if there's nothing there, guess what's going to happen? Nothing. Nothing will change in the patient's symptoms, nothing will change, or nothing will be sustainable in their symptoms at least, because it just keeps coming back over and over and over again. So I hope that you're learning a lot here about manual therapy, because yes, it needs to be used in the right time and right place. Because don't get me wrong, I'm not saying you can't trigger point areas, I'm not saying you can't acupuncture, I'm not saying you can't manipulate. You can, but you must pair it with and marry it with getting the muscles that are not working in. So at least the entire system is then balanced and stable. It must be stable. Without stability, you'll break down anyway. So I really hope that you found this helpful today. And if you want more information in terms of what we do here in the One Method, because yes, we do some manual therapy, but generally we look at the root cause, which is going to be more neurological, but also psychological as well. So we're looking at emotional traumas, but ultimately, yes, we also look at biomechanics to make sure everything is contracting at the right timing. Because remember, strength is very relative. It's not about how strong someone can get. Strength is important, but if they are contracting at the right timing, not only do they become faster, more powerful, but actually they become more efficient as well. So thank you so much for joining me today in today's live, whether it's on Facebook, Instagram, Twitter, or even YouTube. Other than that, I wish you an amazing week and look forward to joining you again next week in next week's live as well. Have a great week. Bye for now.